than the one we have planned without doing some grafting or else ridge splitting. Okay. We'll go around to the other side. This is the number 12 area. Okay. Basically the same situation as you had on the other side. Looks like a reasonable amount of bone. And any thoughts or changes on the position of this implant?
Again, 3.5 by 13 millimeter gives us really good depth
Okay.
and stability.
All right. Okay with that position?
Yes.
Okay. And this is our number 14. And the size of that implant is a 4.8 by 11, so you're able to get a little bit longer implant than you did on the other side.
Right.
Okay. And basically the same situation.
Right.
Okay. So you're okay with those? And if we add the restorative space so you can see you're coming straight out of the implants where you're coming out, those would be the positions. So then it brings up a discussion as far as your plan for restoring this case.
Well, originally, this patient in particular has lower implants than she had 20, 25 years ago, and has always wanted something in the upper ridge. She's relatively young. She's 57 years old, or 58 years old, and is concerned about her future with her denture. It's having to be relined quite frequently, and she is concerned. Our thought process was placing some implants would give her some stability and maintenance of the bone. In a normal situation, again, looking at the panoramic, and my initial diagnosis was that we put implants in the 4 and 6 area, and 11 and 13 area, and maybe do some freestanding locators, keep it very simple. But now that necessity is going to make us place the implants more posterior, the way I look at it is I have two options. I could conceivably continue with my plan of locators, but if that were the case, then I would have to have a full palate in the denture. Now, that's not the end of the world, but again, a patient's going through this process would like to have a palateless prosthesis if at all possible. The other solution to this is to fabricate or connect the implants right and left with bars, which is pretty traditional or pretty conventional as far as the maxilla goes anyways. Have a right and left bar connecting the implants and having some kind of an extension, mesial and distal, with either ERAs or locators or some type of other attachment to retain a palateless denture. And I think that's what the patient would like, if at all possible. And I think with good placement of implants and good stability, good initial stability of the implant, good position, good length, good width, probably a bar and a removable maxillary palateless denture would be ideal for this patient.
Okay, a couple of thoughts from the laboratory side is, and get your opinion on this, is I agree we could split these bilaterally with bars, so we have one bar over here, and then we could do it two ways. We could either we have locators, we have CAD/CAM bars we would fabricate, and then we could put a locator in between the implants, and then extend one off the mesial, or we could extend one off the mesial and one off the distal.
The distal might be more difficult because we're getting pretty far back there. So.
Right, and that way you have the less of a cantilever, the better. So as long as we have 5 millimeters between the implants, then we can put a locator in between. So the thought would be do a CAD/CAM bar here with a locator in between and one cantilever off the mesial to give some anterior support.
Correct.
And the same thing over here. And then as far as going palateless for a maxillary overdenture, then the other thing we would recommend would be to have a cast framework.
Yes.
Here for strength.
And the patient too, Brad, not to interject, but when we say palateless, we're still talking a fair amount of tissue support here. We're not removing the entire palate, but enough that the patient doesn't have a gagging reflex, and we don't really need a post-dam in the denture.
Right, it'd be more of a horseshoe than a true palateless. So it'd be more along this line.
Exactly.
Okay, very good. I think that's a good solution.
Excellent.
Okay, great. Well, I sure appreciate your time. And then, so the next step would be that you would go ahead and you can download and view the plan, and then when you're ready to accept it, go ahead and click Accept on your online account, and then we'll go ahead and order your surge guide, and we'll proceed from there.
Okay, very good.
Thanks for your time.